How does PVR guide surgical decisions for urinary obstruction? Imagine trying to empty your bladder and noticing it still feels full afterward. That's where postoperative residual volume, or PVR, comes into play. It measures how much urine remains in the bladder after you urinate. This simple test can reveal a lot about what's happening inside your urinary system. Doctors use PVR to understand if there's an obstruction blocking urine flow or if the bladder muscles aren't working properly. To measure PVR, healthcare providers might use an ultrasound scan of the bladder, insert a thin catheter to drain and measure the urine, or sometimes use imaging tests. Normally, less than 50 milliliters of urine stay in the bladder after urination. In older adults, slightly higher amounts, up to 100 milliliters, can be acceptable. But if the residual is higher, it suggests incomplete emptying, which could mean there's a problem like a blockage or weakened bladder muscles. When it comes to urinary obstruction, a high PVR indicates urine isn't flowing out properly. This can happen if the urethra is blocked or narrowed, such as with benign prostatic hyperplasia, which is common in men, or with strictures in the urethra. Persistent high PVR can lead to infections, damage to the bladder, or even kidney issues if urine backs up. Doctors look at PVR levels carefully when deciding on surgery. If the residual urine is very high, especially over 300 milliliters on multiple tests, it often points to a significant obstruction or poor bladder muscle function. In such cases, surgery to remove or bypass the blockage, like prostate surgery or urethral dilation, might be recommended. PVR also helps doctors see if surgery will help. If symptoms improve and residual urine drops after the procedure, it's a good sign the obstruction was successfully relieved. But if PVR remains high after surgery, it might mean the bladder muscles aren't strong enough to empty properly, and other treatments could be needed. Monitoring PVR after surgery is also important. A decrease in residual volume indicates the procedure worked well, while persistent high levels might signal the need for further intervention. In the context of bladder health and bladder cancer, measuring PVR helps prevent complications. Elevated residual urine can increase infection risk and interfere with cancer treatments or surveillance. It also helps distinguish between symptoms caused by obstruction and those caused by other bladder issues. In summary, PVR is a key tool that helps doctors decide if surgery to relieving urinary obstruction is appropriate. It provides a clear picture of how well the bladder is emptying and guides treatment plans. By measuring residual urine, clinicians can better understand the severity of the problem and choose the most effective approach for each patient. Always remember, if you have concerns about urinary symptoms or bladder health, consult a healthcare professional for personalized advice.